Welcome to Ask MSVIA, where we answer your most common insurance questions clearly, quickly, and without the jargon. Let's get into today's topic.
Hi, thank you so much for talking to me today. I have a question. What is a claims-made policy, and kind of how does that relate to medical malpractice insurance, which I know the MSVIA is known for?
So in general, a claims-made policy is a policy that covers a claim regardless of when it's occurred.
Mm-hmm.
And of course, that has to be a coverable claim, not just any claim. For medical malpractice insurance, to give you an example of a claims-made policy, it's when a doctor may have a claim made against him 10 years before, could be when a policy occurs 10 years after the policy's been in force.
Okay. So, for example, I practiced at practice 123 and something happened. And then I've moved to practice ABC and it's been 10 years or 8 years since that happened. The claims made policy would cover what happened.
Right.
That claim.
Right at the previous practice you were at.
Okay. But how do they make sure that that's retroactive from one place to another?
So if a doctor's moving to a different practice, they need to make sure that their retroactive date follows them to the new practice and onto the new policy.
Okay.
So the retroactive date is when the doctor first started practicing or the healthcare provider first started practicing. For medical malpractice claims, it's really important to have a claims-made policy because it covers any prior acts before the policy is in effect as long as the policy stays in effect.
So when you say it stays in effect, do you mean, so when I join a practice, let's talk about like what it looks like when I join a practice, how a claims made policy would work for me.
So if you join a practice and you've been a physician that's been practicing for 10 years,
Mm-hmm.
so you started 10 years ago, so you should have a retro date from 10 years ago. So when you join a new practice, you need to make sure that that practice picks up your retro date. So that's going to cover any previous claims that you may get from the previous 10 years of practicing.
Okay, that makes sense. So basically is what it's doing is it's covering me no matter where I am from anything. So if I'm at my new practice and I get sued from practice ABC, for example, I'm still covered over on my new claims made?
Correct. As long as your new practice is picking up your retro date from when you first started practicing.
Okay. And so I guess the question is, do you work that into your contract? How do you get your new practice to sign on to your date?
Correct. So that is something, if you're going to work with a new practice and you have a contract that you're working with them, you want to make sure that they're going to pick up your prior retro date. If not, when the other practice that you're leaving from, you would have had to purchase a tail to make sure that that's going to cover you for any prior acts up until working with this new practice.
Yes, and I've spoken to one of your other associates about tail coverage. So can you talk a little bit about kind of step increases? That's something that we definitely struggle with these. Can you talk a little bit about that?
Sure. So basically what a step increase means is if you are a new provider and you are fresh out of medical school and you're going to work at a practice, there's 5 step increases. So there's step increases from 1 to 2 to 3 to 4 to 5. So basically at step 1, you're going to get probably the cheapest premium or the lowest premium because you're starting to practice. So you haven't done anything before then. So
Right.
you haven't met with you haven't met with patients or have any exposure. So from year 1 to 2, your premium is going to increase because now you have a year's worth of exposure because you've met with patients, and then you're going into year 2. So from 2 to 3, your exposure keeps growing. So now you're going to have 3 years of exposure behind you. So there's a possibility that during those 3 years there might be a claim. So for them 3 to 4, the premium's going to grow again. When you get to year 5, you're considered what's called a mature doctor.
Okay.
So you've gotten years of experience, and then we kind of know from those previous 5 years if any claims have come in. But at 5, you're considered a mature doctor.
So it's basically like when you buy driver's insurance, for example, like you have your driver's license for your first year and you're paying a ton, right? And then we become mature drivers, so it's a little cheaper in some ways.
In some ways, but you still have 5 years worth of exposure out there. But med-mal carrier is going to see you as a mature doctor.
Okay.
And that's when the premiums level out. Now, if you've had a lot of claims before that's going to take into the premium as well, too. But usually your premiums level out. And then you kind of know if there's not any rate increases, you kind of know what your premium is going to be moving forward.
Okay. Well, I think you kind of talked a little bit about why it's increasing in the earlier years. Do increases stop ever? Or like I know you said at the 5-year, but...
So at 5 years, your premium should level out.
Okay.
Now, obviously, if you have claims or there's rate increases, there, premiums can adjust. Or if carriers have rate increases, if you have claims, if you go into a different field or you're adding something new that you normally wouldn't do. So, for example, if you are a gynecologist and you stop delivering babies, then your premiums may drop because that exposure has been taken off of your specialty.
Yeah, that makes sense. Well, because technically got one less patient, really, right?
Right. So you're instead of delivering yes, because when you're delivering babies, that's two
patients.
Exactly.
Right. Okay. Yeah, that's good. So can you talk a little bit about how a claims-made policy benefits a practitioner and why it's so important to have?
Sure. So a claims-made policy is important because it's going to capture all of your exposure throughout your career. So claims-made, for example, if you had a claim from 10 years ago, as long as you have your claims-made policy still in force and it's picked up all of your practice liability from the time you started, then it doesn't matter when that claim is made. So it could be made 10 years, 10 years from now or 5 years ago. It's still going to pick up and protect you with that claim.
Okay. That's interesting. So talk a little bit about, so for retired physicians, would they still have a claims-made policy or they would go into the tail coverage?
So yes, if they're retired, more than likely they would get a tail or retirement tail. So that retirement tail would cover them for the rest of their lives. So if a claim was made, 5 years after they retired, they would still have coverage. Okay. Retirement tail.
So they wouldn't still be paying for the claims-made policy.
Correct. They would be paying for that retirement tail, or they would have paid for a retirement tail.
Okay. Well, what would you tell an early career physician or just coming in physician about claims-made policies, why it's important, and kind of how they should be doing their research?
So when they're coming out, they definitely need to do research on how medical malpractice insurance works. So they need to understand how important it is to have a retro date. And if they're going to work at a hospital, they're usually going to get a contract. And more than likely, their medical malpractice insurance is going to be paid by the hospital. So they need to read in great detail how that coverage works and what happens if they leave that hospital to go work for another hospital or a private practice. So they need to make sure, is there tail coverage provided? Do they have to pay tail coverage themselves? So they definitely need to read that contract very thoroughly. Now, if they're going to go into private practice, then they need to look at get quotes from several different medical malpractice carriers to obviously try to find the best coverage and best price that they can. But they also need to understand that they need to make sure if they change carriers that they've got to have that retro date go with them, if they're changing carriers.
Right. Okay. Yeah, that makes sense. Okay. Well, thank you so much for talking to us today. We really appreciate it.
You're welcome. It was great to be able to share some of my knowledge with you.
If anybody has questions, you can reach out to Stacie or her team at MSVIA. See you guys next time.
Thanks for tuning in to Ask MSVIA. For more resources or to speak with our team, visit msvia.org. See you next time.